I'm Dr. Joel Kopelman. I'm a facial plastic surgeon in Manhattan. I'm going to discuss lower eyelid blepharoplasty or cosmetic lower lids. I want you to be informed prior to going to your surgeon so you can ask the right questions. So what is a lower eyelid blepharoplasty? It's actually removing a little bit of the bulging fat of the lower lid, sometimes tightening the lower eyelid skin, and the corner of the eyelid itself may have to be tightened to counteract any sagging of the lower lid. This procedure is associated with a high degree of satisfaction with a very low risk profile, especially if you go to a plastic surgeon, facial plastic surgeon, oculoplastic surgeon. These are the people who typically perform this procedure, and the procedure is typically done under intravenous anesthesia, which is like a twilight sleep, where you're completely asleep and unaware of your surroundings. And it's also, of course, painless. So how is the procedure actually done? Well, there are two options. One is to do an internal incision inside the eyelid through the conjunctival, which is the lining of the lower lid. And the second one would be to do an incision below the eyelashes and extend it out towards the lateral corner of your eyelid. Sometimes we do both together. But typically, a transconjunctival blepharoplasty through the conjunctiva is the preferred method because it reduces the risk of secondary complications, which could, for instance, be sagging of the lower lid, more bruising, more swelling, and a faster recovery occurs when you do it through the inside incision. This procedure takes approximately an hour to an hour and a half to do. And methodically, we do the procedure from the outside to the inner aspect of the eyelid in order to reduce the bulging lateral fat pads first, and then the inner fat pads last. If you do a transconjunctival blepharoplasty, I use an absorbable suture, which does not have to be removed after several days. It starts to break down itself and is absorbed by the body. Occasionally, I tighten the lower eyelid corner of the eye because it prevents sagging and also gives you a more youthful contour to the lower lid. Only occasionally do I make an incision below the eyelashes to tighten the lower lid skin. I generally do not want to touch the middle layer of the eyelid, which is the muscle layer of the eyelid. If there are wrinkles in the lower eyelid, which are not addressed by doing the transconjunctival blepharoplasty, we then consider using lasers or chemical peels to tighten the lower lid skin. That's an additional step beyond the blepharoplasty itself, but it is part of the procedure. After a laser or chemical peel, it may take up to a week before the skin starts to normalize in its color and texture, but that's to be expected. You can anticipate approximately 10 days of recovery after the surgery where the bruising and swelling subside spontaneously. I've been doing this procedure for 35 years. I've seen patients very pleased with the results of a lower lid blepharoplasty. It's long-lasting. There's very short recovery, very little discomfort associated with it. You just have to be sure that you go to the right person who's been doing these procedures for many years and has a lot of experience with the ins and outs of the procedure. I hope you found this video on lower eyelid blepharoplasty to be valuable and informative, and you'll have the right questions to ask your surgeon. Please leave any questions you have below. I'm happy to answer them. Subscribe to my channel, and I look forward to meeting you again in my next video.